Hey, Aron, welcome to the Nurse Leader Debrief.
Hello, hello.
I'm so excited to have you on. I know we just were mentioning we've been talking about this and planning for a long time, and I'm glad that it finally worked out because I know that our listeners will just learn a lot from you. Um, so we were just talking. I would love to just hear and have you share with our listeners a little bit of your career journey as a nurse and as a nurse leader, because I just think you've had some amazing experiences that I would love people to learn from.
Yeah, sure. So I started my journey in 2013. At the bedside, I actually went to community college, about 2.5 hours from Sacramento here in Northern California. And I started over at a hospital there on a med surge floor. I spent a couple years there, was able to transition from kind of like a med surge floor to kind of a cardiac telemetry floor. And then from there, we decided to kind of move back to Sacramento, my wife and we had our first child. So it was easier to be close to resources and family and such on. But I took a position unexpectedly in critical care. And so I entered into the ICU there in a small hospital outside Sacramento. It's about 8 beds. While working there, I kind of transitioned, continued on school. So I got my bachelor's degree. And then I took a position here in Sacramento at UC Davis. And so I've been at UC Davis since 2016. I entered into assistant nurse position shy of 2 weeks of the pandemic. It was kind of
Wow.
interesting time to enter into leadership. And just before entering that position, I had returned to school for my master's in nursing. And then currently I'm in my PhD.
Wow. What is your focus in your PhD?
So currently, my focus, my master's degree, the topic of my thesis kind of focused on the experience of microaggressions for graduate nurses of color, and then
Mm.
I kind of changed it up a little bit for my dissertation, and so we actually have a program. Many of my other research leadership roles which I forgot to add, is that I'm currently on the executive board for Capital City Black Nurses Association here in Sacramento. And I mention that organization because my dissertation focuses on a program which we did in collaboration with the Greater Sacramento Urban League. It's called Cut to the Chase. This is mental health services that we offer by way of the barbershop for Black men. And so it's led by a
Wow.
licensed therapist. We have groups that range anywhere from 7 to 30 men that show up twice a month. We have different locations, very casual, enter, you could come and go as you like. As far as, you don't have to sign up. It's just an open space for Black men. And so my dissertation focuses on that program and why Black men in the community have chosen to take advantage of the services that we offer.
Wow, that's really fascinating, interesting, and sounds like really well needed. I can't wait to see the outcomes of that. Now, you had mentioned previously about your involvement in Capital City, and I think it was it the Student Nurse Association as well, or somewhere where you had some major influences that have helped you kind of guide you through your path. Can you
Yeah,
talk a little
in
more about
community
that?
college, really focusing over on while I was in nursing school, I was not working, just kind of focusing on school. And so at that school, I was able to put together a nursing club. And so that was like my first kind of leadership role. And I came in as president, and I kind of, the focus of the program was really to kind of engage our members, our nursing students and community. In addition to that, kind of create this unofficial mentorship program. I entered, like I said, outside of the community. A lot of people who were working on prereqs kind of had friends that were in nursing school. So I kind of came in, for a lack of a better words, as the black sheep into the space. And so I didn't really know anything about the program and what to expect or what nursing school was going to be like. And so the club kind of served as a way for us to kind of connect outside of the classroom between different semesters, kind of create, community there. And then from there, once I got into nursing, got busy, you kind of look at things that you set as goals, right? I wanted to continue my education, I wanted to pay off student loans, those kind of things. Once all those things kind of disappeared and I found myself in the ICU, I kind of felt like, all nurses entering, you think of like, I want to go to ICU. It's like the highest level of care. And then once I got there, it was like, okay, now what? And so going back to school was kind of like I guess I'll just go back to school in case I want to go into leadership. And while completing my application, I had a conversation with my manager here at UC Davis, and she's like, "Why do you want to go back to school?" And I said, one day I might want to go into leadership, and I might want to do something different. It's nice to kind of have that master's. And she said, "You really need to find some drive, right? Because you're going to go into school." You don't really know what you want to do with this degree. So how about you step back and look for something that's going to drive you? And she said, I'm going to write you a letter of recommendation, but my advice would be to postpone your admission because I have no problem thinking, I think you'll probably get in. But in addition to that, join something bigger. And that's when she handed me this flyer for Capital City Black Nurses Association. And I tell it kind of dramatically because that's how it happened. Like she just handed me this flyer. I never
Yeah.
heard of the group before. I looked, and Capital City Black Nurses Association is a local organization it's a nonprofit founded in 2018. Nationally, it's part of MBNA, which is the National Black Nurses Association, and that organization was founded in 1971. And so joining that organization really kind of gave me like really what I had found in nursing school. And so I started to get more active in community. And then, that's where you kind of start to get the leadership. People are like, why don't you get on the board? And I got on the board and I had ideas for programs. And I thought I was just giving ideas. And next thing you know, I'm leading these programs. And so there you go with leadership again. You're just kind of creating. And, as nurses, we know how it is. Like we're not trained to be social media experts or trained to be,
Right.
marketing experts or
Or
trained
podcast
to
hosts, I would
yeah,
say.
program design, launch. Like I don't know any of that. So I'm just kind of you're just kind of teaching yourself and, making, learning from those little mistakes. And, but it's been
Yeah.
great. We founded a couple programs. So the Cut to the Chase, which I shared earlier, it's now become the focus of my dissertation. I also have another program called Breaking Down Barriers, which is in collaboration with other local nursing organizations. It was also featured in the Shift Nursing Everybody's
Yeah.
Work. That was like a big highlight of how we're working collaboratively to kind of meet the same goals, right? And
Right.
then, of course, just the different barbershop programs that we've run over time.
That's really, really just tremendous, and it makes me smile and laugh a little bit. So I just saw Everybody's Work, the Shift documentary, just a few weeks ago, and I was like, he's going to be on my podcast. So excited and I'm proud of you there. And I also, it confuses me just a little bit, but I'm sure it'll resonate with our listeners because obviously you're a natural leader. Lots of skills and self grace, right? Which we all have to learn as a person who started my own business and podcast and everything else. I keep saying, like, I've been in leadership a long time and we don't learn how to do these things. Plus, I'm old trying to learn social media, content development, and things like that. But so I myself have experienced imposter syndrome, but I've heard you speak about it, which actually just kind of astounded me a little bit because I wouldn't, I guess it's just kind of surprising, but not because so many people experience it. Would you talk a little bit about how you define imposter syndrome in case our listeners aren't familiar, and then what your experience had been there and any tips to overcome it or deal with it?
Yeah, so imposter syndrome, as I would define it, is kind of like that feeling that you don't belong or you're not capable of, or, it's funny because I think of this game where I can't remember the game, but my kids always say, "Oh, you're sus," like you stick out, like you don't fit in, you're undercover, you don't really fit in with the rest. And I felt like that's how I felt in nursing school and certain parts doing prereqs where at some point I'm going to show my hand and they're going to go, we knew you didn't belong here. We knew it, right?
Yeah.
Or I couldn't believe you fooled us this whole time. Like you were this great student or you had great ideas or, you can lead or whatever it may be. And I didn't have a name for it, right? I always felt it. I always felt like I was like, at some point, it's going to come up and people are going to be like, I knew you shouldn't be here. You're not good enough to be here. But I think a lot of my personal feelings go back to, and I've shared it many times, in high school. When I entered in high school as a freshman, there was an entrance exam. We had relocated to Sacramento. We kind of moved from the Bay Area here in California, and I had to take a reading like test to kind of place me,
Mm.
and I did terrible. I couldn't. I was stumbling over words. I think as I entering in ninth grade, I might have read at like a sixth grade reading level. My
Right.
reading, my writing, my comprehension, all of it was way below where I should have been. And I sat there, and my mom, after I read, she's like, "What are you doing?" Like, no, just read it. 'Cause she didn't know, and so
Mm.
they recommended that I go into remedial classes. And so I started off high school as a freshman in remedial classes, learning, commas and periods and there and there and they are and all that, basic level foundational things, which I'm so grateful that I took that time.
Right.
Who would have ever thought? I know myself, I would never think I would be able to get into a PhD program, let alone nursing, let it, college. Like when you're having those issues, those challenges early on, at that level of education, right? This is beyond foundations in elementary school and kindergarten, right? It's a big problem. And so that's kind of how I felt in a lot of spaces. So entering nursing school, I worked really, really hard. In addition to having that in my history, then I'm looking around and I was the only Black student in the whole building. So then I'm thinking, like,
Wow.
oh, they're going to think I'm not supposed to be here. I'm less intelligent. And so just working, and it was like a lot of internal things, right? And so that's why, and then I kind of helped with the work that I did around microaggressions because I would hear certain kind of things and they would really validate those feelings I had inside that, I don't belong here. This is not for
Right.
me. Also being a male in nursing where you hear comments of, oh, well, you're going to here to rough me up or, whatever it may be. There's so many different signals that tell us like we're not supposed to be here or why didn't you become a doctor? We get that all the time, right?
Right.
And get that all where you're not smart enough to be a doctor. You get that, right? It's like, no, this is actually plan A, right? Like this is what I wanted to do. So, that didn't change in grad school. The only thing in grad school that changed is I actually had a name for it. So we learned about an orientation about imposter syndrome. Here I am entering grad school. And to be totally honest, I knew I was going to go back for my master's. I didn't even know that I really need to do. I didn't know what a thesis was. Like
Right.
I hadn't looked into that. So that was just, they're like, oh, so what you gonna do your thesis on? I was like, okay. Wrote a little note to myself, let's look up thesis. So, of course, when I entered my PhD, I knew I needed to do a dissertation, but I had never done research before. And
Yeah.
so those kind of played around entering leadership. Should I really be a leader? Do I always know what to do? And I think that there's signs that come early on. And I felt like in the ICU, I was a great ICU nurse. And sometimes I look back and I think that it wasn't because I've always wanted that. I never wanted to be the ICU nurse, but I was very aware of that. I was very aware that it was going to be challenging. I didn't go in
Mm.
like I knew everything or I should be there. And I felt like in leadership, there were signs that came along. When you're bedside, my peers would come to me before they came to the charge nurse because they felt I
Mhm.
feel comfortable, right? It wasn't because I had all the answers, but they felt comfortable. Emotionally, psychologically coming to me because I wasn't going to like, browbeat them or make them feel like less than when they come to me. And so that's how I entered leadership is, what I guess people would consider like the servant leadership. Like, how can I help you do your job? I hired you and I know you know what you're doing. And that's where I want to be is I just want to be the support to help you be successful. Uh,
Yeah.
and so looking at imposter syndrome more, in academia. When I'm speaking, people are like, "Oh, you're such a natural. You just speak." And I was like, "I'm nervous. I'm nervous all the time." And it just kind of all goes back to my time in hospitality. I worked in hotels for a while, and I remember at one of my hotels, when you walked out from behind the house, there was a sign that said "Showtime," because when you
Huh,
came out there, you're on, right? So you're just
right.
how I feel when I enter spaces. I'm like action, right? Like I'm playing a role, you know. So when I get outside, I can just go, but I want to come in with the confidence and that I feel that I belong here, that I own this
Yeah.
room, I own this place. This is my space.
Oh my gosh. Well, thank you. Thank you for being so vulnerable to share all of that. I think it's all, I mean, we could go on for a long time, so many different directions that I would like to go in discussion with you because, and I think it's valuable for our listeners. The one piece that I would really like to hone in on for a few minutes, if you don't mind, is your study of microaggressions and what did you learn through that study? I mean, in turn, and I know obviously you have your lived experiences that you were mentioning as well. I'm curious because I think that, we see all sorts of evidence. Well, number one, we know about the structural racism issues that are rampant. We know about the personal racism and the larger acts of discrimination and things like that. Obviously, we know of that, and I don't know that we think as much about the microaggression um, kind of the way that those are expressed, and then the impact from not knowing. We can't know what's unseen to us, right? And so, I guess I'm trying to get at, what do you think a leader who might be listening here can do to help support their team members in general? Those experiences, like you mentioned about your schooling and high school and the imposter syndrome. Those are things that we would never know that people are experiencing until or unless we kind of open that door to discussion. And we also see so much evidence of our nurses at a time when, just like a lot of times in history, we really need to be focusing on retaining our good talent, and
Mhm.
people are leaving because of these microaggressions, because of incivility in the work environment, and I don't know that, and because of relationships with their leaders. So I don't know. What do you think about the leader's role in supporting a work environment where we minimally discuss, if not address and eradicate, some of these behaviors?
Yeah, so to start off at the beginning, so my study, I did work with Dr. Kapir Ackerman Barger, who was my chair for my master's thesis. She's my current chair for my dissertation, and she's done a lot of work around inclusive classrooms. And so I had the opportunity to work with her and
Mm.
her team around the microaggressions. And so they looked at a larger in nursing in general, and I just looked at a subsection of that. So I wouldn't quite call it like a secondary analysis, but I used it. The data was fresh, right? And so
Mhm.
what I found, and we looked at the overall experience of microaggressions, so the number that an individual experienced. In addition, we looked at association with symptoms of depression, and then thirdly, we looked at overall satisfaction with the nursing program. So I want to say there was about 800 plus students nationwide,
Oh, wow.
at 52 different schools. And so what we found is that to look at the overall experience of microaggressions, that Black and Brown kids are people like non-Latino students experience the most, with Black students reporting the most on that side, and non-Latino white students reporting the least. But as far as the symptoms of depression or the overall satisfaction with their education, not strangely enough, but surprisingly, all students whether they experienced just a few or many, it all had a negative impact on their overall satisfaction with the program, and then symptoms of depression. So our non-Latino white students, even though they've experienced them a lot less, it still had an influence on their experience in school, and then also their symptoms of depression. So there's a connection there.
Wow.
But to talk about what leaders can do, there was also a toolkit that was published by Dr. Kapir Akbar-Barger, and I encourage the readers to look into it. I can't recall the name at the time, and maybe you can add it on as a link at the bottom
Sure.
in the comments. I'll send it over to you. But it really looked at like how can we approach microaggressions, right? Because it's not saying that we are going to eliminate the experience of microaggressions. Microaggressions are going to happen. Some are intentional, majority of them are unintentional. And microaggressions are really like you're adding life to an implicit bias. And
Right.
implicit bias, as we know, we're fed that. We're fed in that through movies, through media, newspapers. Who do we see as the bad guys, right? All the way when you're younger, who's from dark hair to light hair to skin complexion, all of it, right? We see it and we're fed that. And it's kind of hard to really unlearn that behavior. And it
Right.
creeps out. And studies have really shown that over the course of a shift, right? You start 1, 2, 3 hours into your shift versus the last 11 hours, and they see that with providers, is that they become more, their judgment is kind of changed, right? Because they're relying a lot on instinct, and their instinct is kind of founded in this bias, implicit bias, and what they characterize certain groups, whether you're here for sickle cell and drug seeking, the things that we connect together.
Right.
Um, so the toolkit, what it does is really talks about how do we address it. And I think that's something that us as leaders can bring to the table. It's not like how can I as a leader fix this, but how can I, a leader, right? Digging back to what I said earlier, equip you with the tools to be successful, right? And so I'm not trying to say like, oh, you're a bad person. You said
Right.
something that was offensive, but hey, you said something that was offensive. These are some things that you could say, like if you self-realize that you said something that might have been offensive, this is how you should approach the conversation with your colleague. If someone said something that was offensive or you experienced it, this is how you can approach the conversation. And then also, if you were for some reason a source of a microaggression, like I just want you to be receptive to feedback, right? Let's have a conversation and let's improve what it's like to discuss these matters as a community. And so that's you. I don't think you could be punitive and you say certain
Sure.
things there. And I mean, conversations come up, right? It's like I said,
Right.
when you're a guy and someone says something about you being masculine or over masculine or rough on a patient, kind of jokingly, not understanding that I get this every day where people think that I'm this bully or something in healthcare,
Right.
or or someone mistakes you for, like me, for EVS, right, by accident or whatever it may happen, right? Like we're not gonna
Yeah.
like punish those, but let's have a conversation about it. Like where do these thoughts come from? This is how it makes me feel. And it offers up the time for an apology. And I think oftentimes, we paint this as you could even it's a binary. You're either a good guy or a bad guy. And I think we should eliminate that. We shouldn't say people are bad people, right? For saying something that was offensive unintentionally. But let's work to kind of find an even ground, and so we have an understanding there. And so I use an example of like I'm walking through the hallway, I step on your foot, and I don't say sorry because I didn't mean to do it. It's not, I'm not going to say like I didn't mean to do that and keep walking. I'm going to say sorry because I'm going to
Right.
acknowledge your pain, right? I'm going to acknowledge,
Right.
that I stepped on your foot. It might have caused injury, and I think that's just the same kind of grounds that we're trying to find when we're talking about addressing microaggressions. But definitely, I will give you that information so that you could present this, right? You could speak to your staff and say, hey, these things happen. I don't want to feel like it's a right or wrong kind of thing, but we just need to be really open to having these conversations to address them.
Right. I agree. I think that's the thing, right? At least even having that openness to discuss and bring awareness, and I mean awareness to an individual. That's the thing about bias, at least that I've been learning, and I'm no expert, but around implicit bias is there's no real, to your point, like long term effective strategy to ridding ourselves of implicit bias. Certainly not gonna happen. However, there's some short term ability to mitigate its impact and or change our behavior by first bringing it to the explicit mind, bringing it to our awareness. And so whether that's through a moment of reflection every day, whether it's through somebody having the courage and in a safe work environment to say, hey, that is a comment that was offensive, or here's why that, and people being open to that healthy dialogue, to me speaks a lot to what would be an advancement in a healthy work environment versus just walking away and not saying sorry or just continuing to walk past because I didn't mean to do it.
Mhm.
Um, that's a first self-aware step of let's bring this implicit bias up to our conscious mind, so we can at least start to understand how it might impact our behavior and try. That's the way you try then to create a new experience and ultimately, um, eliminate is probably a strong word, but mitigate at least the impact of the implicit bias. That's great. And yes, so please send me that and I will add it if I can figure out how. Remember, I'm old, but I'll,
I would
I'll figure.
also, I think, and I'm sure we have, leaders in education, nursing education. I would also encourage, and I could share article or some information from, one of the other stars of the film, Rebecca O'Connor. She talks a lot about the I bias with nursing
Oh,
education, about identifying your any kind of implicit bias you ain't gone in. And I think that a lot of times we kind of leave this out of our foundational education because ultimately we're like, training students to pass the test. And so, that's not
right.
all going to be on it. And so I think, but we're going to have these situations, right, where implicit bias slips out. When you see certain things and you're like, oh, okay, I see, this patient has sickle cell, they're drug seeking, or, they're not going to be a nice person, whatever the bias is for that
Right.
specific group. And I don't mean to pick on, those with sickle cell, but I know that there is a
It's a
lot
good
of
example that everybody can
exactly that
really
everyone can
relate to.
relate.
Yeah.
Mhm, mhm.
Sadly, because that's kind of been normalized behavior. When I talk about, on our part towards patients, that's what I mean in the
Mhm.
nursing community. It's kind of been normalized and accepted, and it's not. We need to address it. We need to recognize it as what it is. And you mentioned the term drug seeker in general, and then I always talk about frequent flyer or other terms that we've normalized in our language that, we don't intend to have an impact. I just don't think we realize the impact that that has on our ability to. The way I always frame it is on our ability to be curious,
Mhm.
which is where we start to, I think, open up dialogues versus, well, even long ago on the theory of interpersonal relationships, what we call the therapeutic nurse patient relationship. The very first step there to develop a therapeutic nurse patient relationship is to set aside preconceptions.
Mm.
That's been talked about for a long time. I don't know how much credence we give it, in terms of all of that. Setting aside preconceptions, in my mind, equates to setting aside or bringing your implicit bias to your conscious mind. And it has to be intentional. And by doing that, you are allowed, you open up the ability to be curious and approach people, circumstances, diagnoses, or whatever with inquiry, with curiosity, instead of leading from what you believe you already know based on a diagnosis or a skin color or a background or a title or whatever else.
Religion.
Um,
Mm.
yeah, I think that's a really, really powerful thing for us all to try to embrace our curiosity. I was just talking with somebody yesterday, in fact, about curiosity really should be a competency. It's embedded in what it means to be a nurse,
Right.
and it's embedded in what it means to be a leader and a human. But really, we have a professional obligation towards it that I think we need to give a little bit more credence to. You mentioned something else, the I bias. Oh my gosh, I loved that. I learned about that from the Everybody's Work documentary as well. I've been trying to reach out and try to get a hold of somebody that's behind it because I actually think it would have a huge place in research.
Right.
You're about to embark on this in your PhD. I just became a PhD candidate, so I passed my comprehensive
Hey.
exams. Yay! And we'll be going forward into it. But I'm studying the psychological distress of nurse managers after events where their staff or patients are harmed. So
Mm,
after a workplace violence or a safety event, that's going to be my dissertation study. I hope once it's approved, and and my uh, my team has been very inquisitive because my background is in nursing leadership for so long, and I've experienced these issues myself. A lot of questions to me about how I'm going to set aside my own bias to be open to the lived experience of people that I'm speaking with. Huge point. And I just loved that. I loved that the learning about that I bias. I think it's great for students, and I'll bet there's. I just get excited about these things. It's so fun because it's just not something that we talk about anymore.
Yeah, I think that we are definitely at a point where we need to be more comfortable being innovative in the way that we educate and prepare nurses. I'm seeing a lot around, and I always say the new generation. I'm like, am I starting to get up there? But I really
I'll always
pushing
be
back.
ahead of you. Don't you worry.
Well, really pushing back on, things that are foundational or expectations. I'm seeing it in medicine. There was an article about, new physicians like wanting a work-life balance. Like, I shouldn't be working all these days. Like, this is just not right. Like, compatible with like how I want to live my life. And
Yeah,
so everyone's like kind of pushing back on these expectations of, the healthcare professionals, nurses, doctors, how we communicate. I'm seeing, I just remember, and I'm sure you might have connections where you have the doctor and you get up and you move out of your chair because there's a doctor here, and come to the phone as soon as you can, drop everything. The doctor's on the phone, right? And so like all these things that we normalized, and even the gender expectations of physicians, and you see it bleed both ways,
yeah,
where you would see, maybe a doctor that's female, and she apologized for being abrasive or, getting upset during a code. And then the male doctor is just, oh, he's passionate, right? It's
right.
like,
Oh, yeah.
it's just,
Well, we do it in nursing too. This is one of the things I talk about all the time, like the good nurse, but oh, he or she's a good nurse, but dot dot dot. And what we mean is that they're not very friendly, right? They
mm,
don't have a great bedside manner, typically
mm,
at least. That's what people mean. Great clinician, not so much on the relational aspect. And what I try to, at least nursing is what I know and what I've studied. And I try to tell people that really, by definition of what nursing is, if you look at our scopes and standards and our social policy statement and our code of ethics and everything, it's actually impossible to be a good nurse without the balance of relational competence and clinical competence.
right.
That they go together. And so that's one thing I like to challenge our thinking on as well. Like, we put up with a lot, we have tolerated a lot of behaviors, and you're right, outside of ours as well, and the all the expectations that we've had. But and really, on a serious note, if we look at it's actually one of those things that we should be saying, actually, that's not what a nurse is, and to be a nurse, let me help you. Again, not punitive wise, but in our programming, we need to be covering the relational aspects, all things about who we are, emotional intelligence, those types of things, and a good, honest review of what is it that it means to be a nurse when you are indoctrinated into this profession. What are the expectations that we have of you? Because people not only don't learn it, then the poor, generationally, not even by age, but by those coming out and practicing nursing now, regardless of age, you don't see it either, right? We haven't required it really to always be present in practice. And so it's really unfair to say you need to be doing this. We need to really look at how we indoctrinate people, and once they're in the profession, what is it that we're tolerating and allowing in our work environments. You mentioned also, just one thing that came to mind that I think is just super funny about physicians. So this was not the case. I'm not that old. I started in 1999. But my preceptors were telling me, some of them that were higher tenured at that time, that they used to go around, the nurses were expected to follow the doctors around with an ashtray
I heard
as
that
the
one.
doctors were like smoking on rounds and stuff. And I'm like,
What?
what? And it again, I hate to judge. I wasn't there and it's a different time, all these different things, but oh my word, right? I don't even know what to say. I'm glad we're not there at this point in time, and it may not be that drastic now, but there are still these kind of micro behaviors that we see and just how things are indoctrinated between you name it, nurse practitioner and physician arguments, physician and nurse and patient's understanding of the difference between the patient and nurse. What gender are we supposed to be?
Right.
All of these things, so much. Oh my gosh, Aaron, we've gone a little longer than I said I would keep you, and I apologize for that.
No
But
problem.
would you say anything to our listeners before we wrap up?
I definitely would say, continue to be curious, like we covered in earlier in our conversation. But I think it would also be really important. Check out the Shift movie, right? I think it adds a different perspective. There's a lot of topics that are covered in that movie, as far as like education, expectations, and as far as what we've seen historically in nursing. And I think it's a really important film. And shout out to Chad Tingo for getting that all together. And Desiree, I don't know why her name's completely Ward, for definitely putting that film together. Because I think it was just very interesting how they put it together, and going in and not knowing who was in the film, and it's a beautiful, and I think that's easily digestible 1 hour film. I think it's a really great entryway for all organizations.
I fully agree with you, and I saw it at the ANCC at the Magnet Conference. It was being shown. We're going to show it at AONL in the spring as well. And so I agree with you, and as much support as we can get behind that. And it is very palatable. It's very powerful. I just love the way it was put together. Beautifully done, as you mentioned. And thank you and congratulations to you for your role in it and all that you're doing. It's just so fun to be connected with you. And I look forward to staying in touch.
Thank you. It's been an absolute pleasure.
Yeah, thank you. For me too.